Hello guys, my name is Savannah, and today I'll be presenting my research proposal on online versus face-to-face cognitive behavioral therapy, commonly referred to as CBT, for postpartum depression. This study will focus on comparing the effectiveness of traditional in-term therapy with more modern online delivery methods. Some of the gaps I was looking at pertain to there not being a lot of research on the long-term outcomes, as well as not a very diverse population group for this study. Moving on to the introduction of this study, postpartum depression, or PDD, is a very common mental illness that affects roughly 10 to 20% of women after childbirth. And it doesn't just affect the mother's emotional well being, it can also lead to problems with the bonding with the infant or even long term childhood development. One of the most well supported treatments for PPD is cognitive behavioral therapy. However, many women face barriers to accessing traditional in person therapy. These are things such as the stigma, it could be no childcare access, transportation issues, or financial issues. Because of these barriers, online CBT, also known as iCBT for internet delivered, has become increasingly popular as an alternative. This shift does raise the important question, however, of if face to face and online delivered have the same treatment outcomes and effectiveness. Looking into existing research on cognitive behavioral therapy, it is widely recognized as one of the most effective treatments for postpartum depression. Studies and meta-analysis consistently show that CBT helps reduce depressive symptoms both immediately after treatment and at future follow-ups. What's especially important is that even brief CBT treatment has been shown to be effective, which makes it as flexible and a very good option for postpartum women who may have limited time or resources. Overall, the literature strongly suggests that CBT is a reliable and evidence-based approach for treating postpartum depression. Moving on, in addition to traditional therapy, internet-based CBT has emerged as a very promising alternative. Research has shown that ICPT can effectively reduce depressive symptoms and offers increased flexibility and accessibility, which is especially important for new mothers. Some studies have even found that there is no difference between online CBT and face to face therapy. However, despite these promising findings, there are still many important limitations in the research. Many studies lack diverse participation sampling, often all falling within the same age range, the same race, and the same social class. Additionally, much of this research only looks at short term outcomes, meaning we don't fully understand the long term effectiveness of these treatments. These gaps highlight the need for further research comparing these approaches across diverse populations and across a longer time frame. To kind of restate the main purpose of the study, we can see that the current research shows two key gaps. First, many studies lack diverse participation sampling, making it hard to apply to large groups. Second, most focus on short-term outcome, missing long-term effectiveness, especially for postpartum depression. The study aims to address both by comparing online and face-to-face CBT across a more diverse sample of postpartum women over a longer period of time. The guiding research question is this: does online CBT reduce postpartum depression symptoms as effectively as face-to-face CBT over time? Moving to my methods, the study will be quantitative experimental research design with between group comparisons. Participants will randomly be assigned to one of two groups, either online or face to face. And treatment will take place over an 8-week period. Data will be collected at multiple points, including baselines before treatment, immediately after treatment, and during follow up periods. This design allows for direct comparisons between the two treatment methods while also examining changes over time. The study will include 100 postpartum women between the ages of 18 and 45, all within 6 months of childbirth. And a really important part of the study is ensuring diversity in the sample, including variations in culture, racial, and socioeconomical backgrounds. To measure depressive symptoms, two standard and widely used tools will be used. There's the EP Depression Scale and the Patient Health Questionnaire 9, also known as the PHQ 9. These measures are reliable and commonly used in both clinical and research settings to assess depression. To analyze the data, the study will be using an independent sample t-test. The test will compare post-treatment depressive scores between the online CBT group and the face-to-face CBT group. The level of significance will be set at the p less than zero point 0.5, which is pretty standard for these types of things, and the analysis will help determine whether there is statistically significance between the two treatment methods, as well as evaluate their effectiveness within the time frame. Spirituality can play an important role in mental health, particularly for individuals experiencing postpartum depression. Research suggests that spiritual well being is often associated with increased hope, meaning, and emotional support, and may be linked to lower levels of depression symptoms. In counseling, it's important that any integration of spirituality is client led, meaning it's only incorporated if the client is open to it and finds it meaningful. This ensures that care remains ethical, respectful, and culture responsive. One example that lines with this idea is Galatians 6:2, which emphasizes supporting and bearing one another's burdens, something that can be reflected in both counseling relationships and community support systems. The study has several important implications for the field of counseling. If online CBT is found to be just as effective as face to face therapy, it could significantly increase access to mental health care, especially for women who face barriers like childcare, transportation, or stigma. It would also support the continued growth and integration of telehealth in counseling practice. On the other hand, if face to face therapy provides to be more effective, especially in the long term, it highlights the need to improve access to in person service in rural areas. Overall, the findings of this study could help inform best practice, improve treatment planning, and guide counselors towards training moving forward. And finally, in conclusion, postpartum depression is a significant mental health concern that affects many women and families. Cognitive behavioral therapy has consistently been shown to be an effective treatment, and online CBT offers a promising way to increase access to care. The study aims to address important gaps in the literature, particularly in terms of diversity and long term effectiveness. At the end, the goal is to contribute to more accessibility, effective, and inclusive counseling practices for postpartum women. And finally, these are the resources that I used within my paper.